Last year, my work life and my personal life collided around the topic of caregiving. I'm a designer. I work in healthcare innovation. I have done for almost 20 years. And I started in global medtech, but I decided that I wanted to move out beyond healthcare into the care space towards social care, and started to work directly with governments and different healthcare providers. The kind of work that I do is about zooming in and looking at the interactions that ordinary people like me and you have with care systems, and trying to redesign those services so that they work better and that they feel worthwhile. And so it was that we were engaged in a project with the National Council for Social Service in Singapore. They came and asked us if we could help to understand the experience of caregivers. Now, these are ordinary family members who are stepping forward to look after people who have very complex health conditions and needs. But at the same time as we received this project request, we were becoming caregivers ourselves. My father-in-law had just suffered the last in a series of debilitating strokes. With these two experiences side by side, I couldn't help but apply my designer's thinking to our family challenges, and I couldn't help but empathize with those caregivers in Singapore that we were meeting, because I felt their pain too. It was an extremely challenging year, but one that was strangely enriching, and it left me with a very different view on my life and my work, for the better. I want to share with you what I learned about caregiving and some of the ideas along the way, because one thing I did realize is that each and every one of us, each and every one of you will at some point in your lifetime become a caregiver to a loved one close to you. Today, the experience of caregiving is far from ideal. And as a designer, I believe it can be better. It's time to redesign caregiving. This is the story of my father-in-law. Here he is pictured with me and my husband last summer in Budapest. 10 years ago, when we first met, he'd already had his first stroke. What followed was a decade of decline. Multiple strokes, minor, then major, leaving him increasingly disabled, both physically and cognitively. In the last chapter of his life last year, we had to take the heartbreaking decision to move him into a nursing home because he needed 24/7 care. He began to fall, he began to ping-pong in and out of hospital, until one night he fell so badly that he was admitted and he never returned. This is a classic story of illness and of aging. One that you could lift from any healthcare journal or article, but we were not listening to this story as a case study to review as part of our work. We were living this as an experience, as a family, as caregivers. And what struck me the most was that despite all of the experience that we have in healthcare, all the skills and tools and knowledge that I'd picked up along the way through my work, we were still totally unprepared. Surely we could have seen this coming. Meanwhile, on the other side of the world, in Singapore, we were spending time with 10 different caregivers, each with their own particular family circumstances and challenges. And I'd like to share 2 stories with you. The first is about this lady, Amal. She looks after her son, who's now 18 years old. He was born with a severe physical and mental disability, which means he has the mental age of a 1-year-old, and he needs help with every activity of daily life. She's also caring for her mother, who has dementia. Now, Amal's story is truly inspiring. She's something of a role model for caregivers in Singapore, but it wasn't always like that. The beginning of her story was actually a very, very dark period where she struggled to come to terms with and accept the fact that she'd had a disabled child. She felt ashamed of him. She felt the stigma of her community. Now, she managed to get through that to a place where she could accept her role as a caregiver. Her family, her community, and her faith helped her get there. What was truly inspiring about her story for us was the fact that even though she was able to embrace caregiving, she still held on to her own identity and her own sense of self. And along that journey, she built up the most incredible network of support for herself, involving her family, but also health and social care professionals. It was a team effort. For her, caregiving was a blessing. The next story is of Madame Wong, and it's a story of despair. She lives with her husband and her daughter. Her husband suffers from a mental illness that means he has violent outbursts, and it can be quite unpredictable when that's going to happen. When we met her, she shared with us a routine that she set up. She keeps a bag packed by the front door, just in case the situation at home gets scary and she fears for her safety, she can escape. She's the person that goes with him to all of his healthcare appointments, to his community care and social care visits. To the outside world, on a good day when his medications are balanced, things look fine, under control. But the reality of the situation at home can be entirely different. She shared with us the fact that she makes secret videos on her mobile phone when he has an outburst at home. She captures that in order to try and share it with some of the care professionals that they meet. So they go for his appointment, and she steals some minutes to tell them about her situation. It's a true cry for help, and it's the only way that she knows how. This is a woman living in survival mode. So what did I learn from all these different stories of caregiving? I learned that there are 4 things wrong with caregiving today. So the first is that it's unwanted. It's a negative in our society. None of us want to take on that role or responsibility. We dread it. We even call it a caregiver burden. This perception then drives our behavior, because the second problem with caregiving is that it's unspoken. Not even in our families can we dare to bring up this topic. We don't have the tools, the vocabulary, we don't even have the occasion. Except when there's a crisis, and then we're in reactive mode. The third thing wrong is that caregiving is unseen. Our care systems fail to recognize the caregiver. They are invisible, unnoticed. Now, it's understandable. Professionals are focused on the patient and the client, but they fail to notice that person right next to them who is helping with the care. There is no structural integration of this into professional practice. Caregiving is a blind spot in our care systems. Finally, caregiving is unsupported. It is the caregiver that is the red thread across all the different touch points with care services, and yet they journey alone. So imagine you're a caregiver and you're doing something that nobody wants to accept, nobody wants to talk about, nobody wants to see or support. How does that leave you? You're exhausted. And indeed, caregivers burn out. They get stressed, they get depressed, their own health suffers. Ultimately, they too need care. So let's step back a second and reframe these problems. I would like you to think about another act of caregiving. parenting. My husband and I are parents to this wonderful little boy, Arun. He's 6 years old. He's 1 year old in this picture, and yes, he was made in Barcelona. Parenting is an act of caregiving that we all see as positive. We celebrate this. We even say it takes a village to raise a child. The whole community wants to be involved. We support and coach and guide parents throughout the entire journey of raising a child. We give them tools and products and services. We design policies that nurture the family. And no one says this is an easy job. It's also an experience filled with highs and lows, with joyful moments and moments of despair. So I want to ask you, what if we didn't make a distinction between caring for the young and caring for the old? Between caring at the beginning of life or caring at the end of life? What if we just cared about caregiving? What if we supported caregivers? What could that look like? So, as a designer, you ask a question like that. As a designer, we want to try and answer it by making things real, coming up with ideas, building prototypes, testing them. So that's exactly what we did. Based on everything we learned from all the caregivers that we met, we translated this insight into ideas, and then we worked together with them, with our caregivers, with all of the professionals, to co-design new possibilities. Now, I'm going to share 4 of these ideas with you, and I don't want you to see these as solutions. I'm not saying that this is the answer. This is the beginning of a step in the right direction. We wanted to see what happens if we shift caregiving from being something that is unwanted to something that we see as an essential life skill that we want to teach our children in their schools. This is an educator's toolkit. It's called Care Class, and it literally brings the topic of caregiving into our curriculum, alongside maths and alongside science. It allows kids to get aware of the values and the capabilities around caregiving and to practice those in the classroom and out in the community. It's a way of normalizing caregiving and of building a compassionate community from the ground up. We wanted to take the moment of crisis that I talked about and see if we could turn it into an opportunity for families to learn, to give them that missing vocabulary, those missing tools and knowledge, to build their confidence and their ability to cope. So one feature of this idea is that a family could capture an event and later on review it with a professional in order to understand how they coped and to build resilience and understanding for new coping strategies. It's something that if Madame Wang had at her fingertips, maybe she wouldn't need to keep that bag packed, ready by the door. Caregiving was unseen. We wanted to design it to be visible, to be actionable. And this is a toolkit developed with social workers to put very practical tools in their hands that they can work directly with the caregivers next to their clients. We're creating a new conversation of care here, one that's much more to do with partnership. So together, the social worker and the caregiver can co-design solutions that really fit to this person that they're caring for. If caregiving is unsupported, we wanted to design that support in a structural way. So we came up with an idea for a new protocol. We can't expect care professionals to suddenly switch their behavior overnight. We need to facilitate this transformation and give them the tools. So this is actually a way in which a doctor can refer a family to community care, so from the hospital into the community. And it makes transparent that transition journey. It allows families to know where they are, who's there to help them, and what happens next. It's simply holding their hand through the process. We can't all be as resourceful and inventive as Amal. But if we have ideas like this, then all caregivers can build up a personal network of support. So, what happens next? Well, in Singapore, it's a very, very exciting moment. Some of these ideas and more are about to be piloted as part of their 5-year strategic master plan for the nation. But what can all of us do in the here and now? What could you do tomorrow? I'd like to invite you to reflect on what is your caregiving story. Notice the caregivers in your family. Break the silence. Talk to your family. Share about your fears, your expectations, your needs as you get older, as they get older, or as perhaps loved ones get sick. If you're a care professional, you can start tomorrow by including that caregiver in your conversation together with your patient or client. And if you're a decision maker, I would ask you to step back, take a look at your organization, take a look at your processes and see, are there any blind spots where caregivers are going unnoticed and where you can make a difference? I'm a design activist, and so I'm passionate about transforming our systems of care. I'm looking forward to my next step, which is facilitating this dialogue, working with all of you. Kids are fantastic at asking the toughest but the most important questions. And I know that one day my son will turn to me and say, "Mama, who cares?" And I want to be able to say to him, "We care."